So, when reviewing an x ray, when deciding whether or not to save or extract a tooth, the x ray will, an AI will show about how much healthy tooth structure is left. And at some point, when there's less than a certain amount of healthy tooth structure above the bone, the better option is to extract the tooth versus saving it. Also, AI will mark any areas of possible infection around the roots of the tooth, and it will highlight it in blue for a patient to easily see that the tooth is infected and that extracting it may be the necessary treatment. When possible, I always encourage my patients to save their tooth if it's within reason. A few reasons to save a tooth may be that you're really young, that it is an important tooth, such as a molar or a canine, that we will rely heavily on for both speaking and function. Especially if the tooth does have a lot of healthy tooth structure remaining, a root canal and a crown is a great option to save that tooth for a few more years, even up to 10 years. It's a great option because at the end of the day, I don't think anything beats having your natural teeth in your mouth. All cavities start out the same. They start out small, but once they become sticky, they grow really fast. And at some point, it gets closer to the nerve. And when it gets closer to the nerve, your treatment options change. When it's small, you can typically just get a filling. Eventually, it gets bigger. Maybe you can get away with just a crown. Eventually, if that cavity does end up in the nerve, now you're looking at more treatment, which costs you more and takes more visits at the dental office. It may not have as high as a success as maybe a simple filling compared to a root canal. And worst case scenario, you wait really long and now there's nothing left to even provide an option to save the tooth. And at the end of the day, I want to make sure that is an option to our patients, which is why we try and get them in the door as soon as possible. So I think tooth pain is a very serious feeling. I've been there before, and I want to make sure my patient knows that we understand their pain and that we're here to help them. We may start with an x-ray to figure out exactly what tooth is needing the treatment. As soon as we know what's going on, we give the patient all their options and also help them answer their questions to guide what option may be the best choice for them. And if we're able to provide that same day treatment for them, we're more than happy to do that to get them out of pain. For patients who may be interested in replacing missing tooth or soon to be missing tooth with an implant, it's really important that they understand that a bone is essential to the success of an implant. Once you remove a tooth, it is almost like an empty socket or a hole. And if we don't put any bone in that socket or hole, it will heal that way. And then when it comes time to you wanting to get an implant, you might not have sufficient bone in order to get that implant. Versus if the same day you get your tooth out, we're able to put a bone graft in, that bone will heal with that extraction site. And by the time you're ready, 3, 4 months from then to get an implant, you'll have a great foundation to put an implant in. So, sedation is a great option for patients who maybe can't keep their mouths open for a long period of time. Maybe they get overstimulated by the different noises in the dental office, or they simply would feel more comfortable if they were asleep during the procedure. So, we want to make sure that's an option for our patients, listen to their concerns, and let them know that we can totally do with that procedure for them comfortably with the sedation. So the biggest mistake a patient can make when they are waiting it out with a toothache is eventually that tooth can get to a point where there's not enough tooth structure left to save that tooth, or maybe the cavity or the infection has spread to a location in which we're out of options and the only option left is to take the tooth out. As someone who cares about your health and wants you to keep your teeth for a long time, I think if we can give patients more options to save the tooth, that's better for the overall health. And so we'd love if they came in earlier to allow them to have all the options available to them. Honestly, when patients feel disappointed about losing a tooth, I get a little vulnerable and honest with them and let them know that I had to lose a tooth. At one point, it happens to all of us. Teeth are not the strongest thing in our body, and they cause a lot of problems throughout our life because we use them every single day. And sometimes it comes a point where we may have to lose one, and I just like patients to know that it doesn't make them any less of a person. I'm a dentist and I've had to have a tooth pulled before, and so I like to get vulnerable and let my patients know that it's okay and that there's solutions to replace those missing teeth.